So here in Portree we've had the Symposium on the future of digital health and care. We've brought together all the partners that have been working for the last 3 years in a UK-wide project called Dallas.
Dallas is delivering assisted living lifestyles at scale, and it's the demonstration phase of an innovation platform called ALIP, which was the Assisted Living Innovation Platform.
I think one of the things that really excites us is that how things like self-care have come onto the agenda during the time of Dallas. It really wasn't talked about that much 3 years ago, but now there's the idea that people can use the technology that they're already familiar with to receive and deliver healthcare, and to interact with their healthcare services, their doctors, their nurses and hospitals in new ways, using things like apps and websites and tablets and so on, things that people are very familiar with already.
I think what we've always struggled with is knowledge about the technology, understanding the fear that sits behind that use of technology. I don't want a box in my living room, I want a real doctor. You know, and they're real concerns of people, and actually we're bringing you closer to the health service, we're looking after you far more closely than just waiting at some point to see a clinician.
This is highly important. We need people to live longer at home, healthier at home or in a homely setting.
Nobody really wants to end up their days in a care home or a hospital. So the longer we can stay at home, happy, healthy, well looked after, surrounded by family and friends, and that's surely something that that's good to work for.
Programmes like Dallas in particular, you kind of have to wait till the end to get some of the insights and the lessons learned. And so for me, what's been valuable is sharing that with other people that are doing the same thing and doing that quite honestly so that we can learn what to do and what not to do.
I should say that the Dallas initiative ticks so many of the boxes in relation to delivering the Scottish Government's vision of a digitally enabled Scotland.
I think it's only now that we're starting to see from all the Dallas projects real seeds of innovation that could be shared, and we certainly have an ambition to share our innovation and to use others' innovation.
It was great to get everyone together to share best practice, what worked, what didn't work, and to share that beyond the Dallas team.
Well, I think Dallas has really changed the expectations about digital health and care. When we started, Dallas had been the outcome of a number of small-scale pilots and technology projects that had just shown possibilities. But what Dallas has done is shown how we can bring the whole thing together into a coordinated delivery of health and care to large-scale populations.
What we need to be doing is developing services that are the mainstream experience of the NHS, of local authorities and of citizens across the UK and Europe. And I think we're absolutely on the cusp of that.
Dallas was incredibly ambitious, but I think what it's shown is it has changed things, and I think it has the opportunity now for those things that it's changed to be upscaled. You can sense enthusiasm.
I think the real benefit and the evaluation that should come, I think will be seen in the outcomes. So when we start to see people thinking differently about health and care, that actually they start asking their doctors for apps rather than asking the doctors for pills.
Yeah, the sorts of audience that we really want to get a hold of now are the undecided commissioners and procurers within the statutory sector, but also some of the new innovators from the smaller digital companies that may not have even thought of health as a market in the past.
So the biggest challenge for us has been identifying organisations that have the capability and the desire to change.
So specifically from today, what we really want to see is the flourishing of a new community of people coming together to build on what Dallas has already created.